So Medicare is earned. It's a very popular notion. It's a very common belief. And it's very much how Medicare has been presented to the American public since the program really was passed. That this is a program that you are paying in to it during your working life. You're paying taxes into the Medicare program, and then when you retire, you earn the right to collect benefits from this program. That's how the program is sold. No, this is not a welfare program. This is not a handout program. That is what people explicitly say. But in reality, Medicare is a welfare program. Medicare is a handout program. That's how the program works. And it's important for people to understand this, to really understand what Medicare even is. So a lot of people think, okay, well, aren't I paying into Medicare? I get taxed for Medicare on your paycheck every month. You see a Medicare payroll tax. It's right there. Where's that money going? Aren't I paying in? The reality is there's no saving in Medicare. There's no investment in Medicare. The minute the government taxes you for Medicare, it takes your money and it spends it on today's seniors. The government is not saving anything of yours. It's not keeping it anywhere. It's spending it on today's seniors. When you retire, Medicare is going to pay for your health care by taxing other people. Everything that you, quote, put in, it's long gone. That's the Medicare program. It's the federal government taxing some people to pay for the health care of seniors. That's a welfare program. It's not insurance. Medicare is often compared to insurance. Isn't it like health insurance? No, Medicare is not insurance. Insurance companies do not take some people's money and spend it on other people. That is not the hallmark or the main characteristic of insurance. Insurance is about managing risk. There's no risk assessment going on in Medicare. There's no looking at different policyholders and assessing, well, how much premium should I charge this person, and what's their risk of getting sick, and those kinds of things that happen in, for example, life insurance, right? You're charged differently depending on your risk level. So Medicare is not insurance at all. Medicare is a wealth redistribution program. There's no trust fund. We hear often a lot about, okay, well, there's a Medicare trust fund. And it suggests that your money's being saved, it's being invested, and that it's being kept for you to be able to draw on at a later time. No trust fund. The trust fund basically is basically one way by which the government is paying for seniors' health care. It's one avenue. So what goes in the Medicare trust fund? It's all the payroll taxes that the government collects. So the government taxes you on your paycheck. You see your payroll tax. That goes to the Medicare trust fund. It stays in the trust fund for 2.5 seconds, and it goes then to pay for another senior's hospital care. So hospital expenses for seniors are paid for through this trust fund, and the trust fund is funded by other people's money. So there's no saving, there's no investment, there's no trust fund. It's a myth. It's not insurance. Medicare, when it comes down to it, is a program that forces some people to foot the medical bills of others. And if you're on the receiving end of that, you cannot say, well, I've earned a right to have other people pay for my medical care. I've earned a right to force other people to pay for my medical care, which is what Medicare does. It's about force. It's about government coercion. And it makes no difference. It makes no difference that you were coerced when you were younger to pay for other people's health care, to pay for the health care of seniors in the past. That doesn't make a difference. If that was wrong, it's equally wrong for you to now say that other people now must be forced to pay for my health care. So this is not about earning anything. This is, at its base level, it is a welfare program. It is an entitlement program. It's a redistribution program. That's what Medicare is.